So we were discussing about the methods of Rasushadhis being used in the Panchakarma practice. Whenever we have to speak about any of the crystals available to an individual, whenever we have any of the issues like that of the natural substances, they do have enormous energy within it. They can attribute to an individual. So this has been well praised in the system of Ayurveda, where they speak about with the methods of Lokapurusha Samyavada, or you have the references in the Rashastra as Yata Lohe Tata Dehe, in the sense whatever the changes the substance can show in a metallic plate, so will be the changes on the human individual. So similarly, you have this particular phenomenon being well addressed by administration of the Rasushadhis in the Panchakarma practice as well, because the energies which are there in the crystals are being released into the humans, and the negative energy in the form of a pain or anything are also been vanished or have been absorbed. So for the people who are very much interested to know about the Shat Chakras, because we have also learnt from the science of Yoga Shastra, Swastha Vritta and Yoga. So there we have learnt about from the text of Hatha Yoga Pradipika and other textbooks about the Shat Chakras. So in all the Shat Chakras also, every Shat Chakra or every chakra of the body, like might be it is Mooladhara, Swadhisthana, etc. up to the Sahasrara, they do have specific crystals which are being enumerated in the science, which can be used for treating or normalizing the doshas and the other issues related to that particular chakra. And for the people who are believing with that of the Purusha is having many organs, and every organ is being signified with a particular star as per the Indian culture, and every star is having a particular stone which is being related to. So based on that also it can be related as the Nakshatra Rupani and also as per the Shat Chakras. Let us concentrate more on the Shat Chakras. What are the specific crystals which can be given for the treatment as per the chakras, and wherein you can have the choices of various crystals which can be used in either of these phenomena. And later on, the same chakras can be placed on the locality in the body to see what best they can have the therapeutic properties, to see what best they can show the response in an individual. What you need to do is just keep those crystals over that chakra in the body and just leave it. So this is a phenomenon of going with the crystal meditation. The same thing for the duration. It should be approximately for 10 minutes. It's sufficient, wherein the crystals can adore this their energy into the body system. The same thing is being adopted in the Panchakarma practice. Either it is Shirodhara, or it is Abhyanga, or it is Katibasti, or it is Ridbasti, or Janubasti. Either of the things, crystals of that particular area are being placed to see that you have the maximum benefit or the therapeutic benefits of these crystals as Bahir-Parimarjana Chikitsa or Manidharana Chikitsa on the individual. So these are the crystals which can be very much utilized, which can be placed very near to the patient as well, because they are having their own energy which they can increase the prana shakti in an individual or reduce the negativity of a surrounding area in the premises where the patient is living with. So you have something like when you have a patient of Vata Rakta, when you have a patient with ankle pain, nowadays it's very popular to have vitamin D deficiency, any of such complications whenever you have. Normally what we do is we take some amount of Rajavarta, which we call it as a Lapis Lazuli. The powder is made and a poultice like, we make it a sort of a pouch, and we just keep it on the affected area, especially on the foot or sole or near the thumb finger of the leg, or wherever you have the disturbance, wherever you have that pain, wherever you have the discomfort. So in all these areas, by placing them, you have the pain being reduced, the Vata is being regulated, and also it addresses the situations of the Rakta Dhatu. And this has been as per the reference of Rajavarta from the Uparatna Varga. And that is how this is being utilized into various therapeutic protocols. Similarly, by placing a quartz crystal, simple quartz, Spatika Mani of Uparatna Varga, over the forehead helps you to focus, to have a normalcy, to have a peace of mind. It is extremely useful in anxiety neurosis, psychological disorders, disorders of the Rasavashrotas, disorders of the Manovashrotas, disorders like the anxiety neurosis, hypertension, insomnia, or any of that conditions. You can place it over the forehead and ask the patient to just lie down. Might be it is a status of the Shavasana. Or the same phenomenon can also be adopted in the form of Shirodhara, which will be coming across in discussion. Added to that, the Udvartana or the Abhyanga like phenomena can also be adopted, as we can see with the Gairika Churna, which is extremely useful in all the conditions wherever you have the Pitta Adhikyata in an individual. Sarvanga Daha, Sarvanga Kandu, Sarvanga Toda. Either of the conditions of Vata, Pitta, Kapha, specific drugs can be taken in the form of a Lepa Kalpana or Udvartana, or you can see that the condition is being improved very well. Especially in the conditions like SLE, systemic lupus erythematosus, or any of the condition with Sarvanga Daha, I usually tend to do it with the Gairika Churna, Abhyanga with the Gairika Churna, or Udvartana with the Gairika Churna. Similarly, we try to do with the Haratala in the conditions wherever you have Medu Adhikata. Sometimes we mix the Haratala Churna into Kolakulatadi Churna and mix it and do Udvartana to the patient. Sometimes we mix Haratala into Trifala and do the Abhyanga, or in the form of Udvartana. So such procedures can be adopted with various drugs, and they can be utilized. We are not even doing the Shodhana of the substances here, especially of that of the Rasushadhis, because it's only for the Bahir Parimarjana. Only thing we should be cautious is the patient should not have cuts and wounds, so that the drug might not penetrate into the system of an individual. And added to that, in case if you don't want to go for such treatments, there are certain centers nowadays which are being erupting, wherein the crystals are being placed at a particular distance of nearly 1.5 feet away from the patient, and a light rays are being passed through them, and see that the light rays will fall on the patient body to see that they have a sort of a radiation through these crystals into the body of an individual. So this also benefits a lot to an individual in the form of a crystal therapy. Or in our systems, like where we are speaking about the Panchakarma practice, we can make the patient to lie down, we can place the drugs which are related to that condition. Say for example in the psychosomatic disorders or conditions like Tandra or anxiety neurosis, especially during the exams, the children will have lots of tensions. So in those conditions, what I do is I try to place a Chandrakanta Mani. And go for the Shirodhara. So in the Panchakarma theatre, like this, whenever we pour the substances which are related to the patient's condition and the patient doshic configurances, just we try to add up is we add a Chandrakanta Mani there, which is Atyanta Shita, and also it reduces the effect of adverse Vata and Pitta. So on that grounds, we try to place this Chandrakanta Mani over the forehead and try to see the classical procedure of Shirodhara is the same. We are not altering any of the phenomena. And by this, as I spoke to you already in the prior discussion, we have the piezo pyroelectricity. Through this phenomenon, the energies of the crystals are being transmitted into the individual. And of course, as per Ayurveda, whenever we want to speak about, it is the Manidharana Chikitsa in Panchakarma as a Bahir Parimarjana. Similarly, crystals like a malachite, which is taken as a sasyaka possibly, are being placed over the head region of the patient and ask him to take for the Bashpasveda. Malachite is one such crystal which is very much essential in such a treatment protocols wherever you want to go with. And these malachite crystals, of course, they are beautiful to look with, but added to that, they are also therapeutically very beautiful. Just by Manidharana, we could observe like the patient's condition of health issues is significantly down, especially related to the Medova Shrotas. Similarly is the Gairika Tailam, what we name it as Ananda Tailam, where we have mixed up the Gairika, Jasada Bhasma, and prepare a Taila out of it with the Panchavalkala and all. And this Taila, which is a derivative of the Bhasmas, can be used in the treatments in the form of Abhyanga. which is also extremely useful in the conditions wherever you have skin burns, sunburns, or cosmetic issues, or related, the conditions related to that of Pitta and Vata. I could appreciate lots of response in the patient. The same Taila, Kalka Churna, whatever we have, can be used for the Abhyanga in the form of Udvarthana. Only thing is, if you want more Pitta Shamaka, I have observed this particular phenomenon wherever the patient is having a multiple petty chain hemorrhages. Many times you have many of the hemorrhagic conditions all over the body. I have added lots of Gairika Churna into it and made the patient to have Udvarthana. Gairika is one such drug as per the textbook claims as Rakta Srava Hara. So this Rakta Srava Hara will definitely help the patient as a Bahir Parimarjana Chikitsa as well in the form of Udvarthana. So there are certain reports even which we have tried to focus by keeping such treatments, external treatments, like the conditions in diabetes. So no other oral medication was being given. Only the medicines in the form of Bahir Parimarjana also proven to be wonderfully benefited in most of these clinical conditions, wherever the person has shown lots and lots of responses with a significant improvement of the glycemic index. Fasting and postprandial, which was quite high, has turned out very low or moderately significant within a short period of 1 month. So in case if it can keep for a longer duration, it is further going to definitely benefit the patient and it is going to help the patient a lot. So these Bahir Parimarjana Chikitsas are also very much helpful for having a therapeutic index. We have another method wherein we go for the Padabhyanga, or what we call it as a Pada Prakshalana, wherein the patient's leg are being immersed into the water, and there we are placing lots of crystals. Usually I am using multiple crystals. What all the Rasushadhi crystals, whatever we have, the powder form of it, in the form of a curd, what we call, they are granules, which are being placed within the water, and we ask the patient to keep his leg into it, and later on those crystals can be taken and give a sort of a mild scrub on the pada, which is also stimulating lots of nerves which are in the sole of the foot of the patient, and it is going to have lots of benefits in the patient. The overall benefit, it's not like it's good only for the cosmetic issue on the leg, it is also very much beneficial for the therapeutic efficacy of an individual on the whole body as well. So these are a few of the benefits where you can see in the Bahir Parimarjana. In case if the patient is having conditions like rheumatoid arthritis, wherein the person is having severe pain in the fingers, because rheumatoid arthritis affects the smaller joints, in all those conditions we are placing the crystals on these phalangeal and interphalangeal joints, like the Chandrakantamani, wherever you have Vata and Pitta Adhikyata in the Amavata, we are placing the crystals on the affected area and just leave it for 10 minutes, 15 minutes or 20 minutes, and again ask the patient to have a regular hand wash. So this Chandrakanta, what you call it as moonstone, is a very good analgesic effect, and it regulates the Rakta, Vata and Pitta. So it's very much beneficial for those clinical pathologies. And in case if the patient is having a osteoarthritic like presentations, one thing is you have a knee strap where you have the knee belt, or you have a crepe bandage, or the other alternative, the best form what you can do is you can go for a simple cotton bandage. We usually place a stone called as a bloodstone, which is a very good analgesic for the knee joint. It is also called as a Raktaksha. It is being mentioned by Acharya Chalukya in Arthashastra in 4th century text, wherein this crystal can be placed over the maximum pain affected area in the knee joint and wrap it with a cotton bandage and just leave it. You can remove it after 6 hours. By this you can see significant improvement of the pain in an individual. Or sometimes what I do, I want to take the dual benefit. What I do, I immerse the cotton bandage into the oils. Might be it is Kottam Chukkadi Thailam, or you go for Chinchadi Thailam or Murvenne, anything like that, and I squeeze the oil out. I keep the crystal on the most affected area of the knee joint and make a bandhana. And make a bandhana means a sort of a bandaging to the knee joint by keeping the crystal in that way. Sometimes I am leaving this crystal there itself for another 1 day till the patient comes back to me the next day. Then the bandage has been removed and we can find a very good response in the patient with a significant improvement. Only thing is to see that the crystal doesn't have sharp edges so that it pricks the patient's body. Instead, it could be very beneficial in case if it's a smoothened or a tumbled or a flat crystal, which is very easily available in the Indian market. And next we will be discussing about the Antaparimarjana Chikitsa with that of Panchakarma. So Antaparimarjana Chikitsa in the sense where we are giving the drugs orally, internal administration of the drug is being given. By that you have an excellent response in an individual which can show a definite benefit in a person or overall benefit of the therapeutic dosage forms. So the oral medications used in Antaparimarjana Chikitsa of Panchakarma, there are many drugs. As we have discussed, for Vamana it is different, for Virachana it is different, for Basti it is different. So various treatment protocols, various drugs are being mentioned. But you have certain common drugs which can be added. Those things for the rasa practice is some bhasmas. We are adding some bhasmas for all these therapeutic protocols. Before we understand what are these therapeutic protocols, we need to understand what is the micro and macro particles which are used in Rasashastra and Panchakarma Chikitsa. Whatever the bhasmas we give or whatever the drugs we are giving, don't ever always think like I ask a patient to eat a coin or eat a piece of rod of copper, iron or either. It's not going to get assimilated into the body and gets and accumulated into his kidney and cause a heavy metal toxicity or poisoning. It's not absorbable. There are micro and macro particles in the bhasmas or in the powders, whatever you are prescribing to the patient. Specifically about the bhasmas, I would like to speak about. It's absolutely safe. The body knows how to guard itself. You have many times the receptors in the intestines or in the gut which are being stimulated by the oral administration of the macro particles, and they don't get absorbed into the system. They are being just eliminated into the fecal matter as it is. So these receptor mechanisms from the gut are being stimulating the various organs of the body by producing some coenzyme, enzymes or anything like that, and regulate the therapeutic fashion of an individual in respect to the health functions. So these benefits are being done by the macro particles, which are major components in most of the bhasmas which we are administering today. Added to that, you got certain microparticles which are really nano in nature and being absorbed across the mucosal membrane and enters into the intracellular fluid and shows its therapeutic benefits at the level of a intracellular level, and which is going to have a real therapeutic efficacy from the intracellular. And this happens whenever you go for excess of jarana with that of gandhaka or sukshma srotogami like dravyas, or you should have some substances like the potalis etc., where you have done multiple gandhaka jarana so that they have the deeper penetration and faster quick response in an individual. So these are the benefits or the differences between the micro and macro particles which we are using in Rasashastra. So this particular phenomenon is comparatively less with the herbal components, because the drugs have to get assimilated through the means of osmosis from the region of higher concentration to a region of lower concentration, and then show the therapeutic efficacy. Definitely it is beneficial. It is highly appraisal that they are showing the therapeutic efficacy in an individual. But in a mineral drug, it happens like they penetrate through their corrosive effect, the microparticles, and they show their benefit at the intracellular level much quicker. That's the reason why you have Kshipram Arogya Dayitvat and Alpamatrasya Upyogitvat. This is the reason why it is called as Alpamatra. The next thing is, whenever you are subjecting the patient for the Panchakarma, in the Purvakarma, wherever we want to go for the Doshotklesha, where we would like to increase that particular dosha, what I usually do whenever I want to increase Vata Prakopakara, you have the drugs like Vanga, which has been explained in Rasaratna Samuchaya 5th chapter, where he explains by administering Vanga as per this particular prescription, it is going to increase the Vata. Similarly, Vata Pitta, in case if you want to increase Vata and Pitta, Tankana, as explained in Ayurveda Prakasha 2nd chapter, it increases the Vata Pitta. So for Doshotklesha, whenever we are giving Snehana to the patient, we can give these drugs mixed up into them to see that you have a appropriate Doshotklesha, then you can have the elimination process or the Shodhana process. Similarly, Pitta Janana set of drugs, as you see in case of Vanga and Jayapala, Pitta Krucha substances as that of Tankana, Kapha Vishleshana as such of Navasadhara, Tankana and Gunja as claimed by the textbook of Rasatarangini in chapter number 14, 13 and 24 respectively. So these drugs can be given for Doshotklesha in the Purva Karmavastha and say that they have a quick response in an individual. Sometimes because of the Agni, you are unable to do the Doshotklesha by which the total doshas are not being eliminated out. So they go and hide inside the body, might be in the Alpa Doshavastha or Lina Doshavastha, which could cause the grave problems to an individual in future. So to ward off all these Lina doshas or Alpa doshas which are being hidden elsewhere in the body, you need such a drugs of Rasushadhis to have a quick response in an individual as Doshotklesha, and then you go for the classical procedures. Like say for example in case of Vamana, we are giving the small concentration of copper powder in Vamana Karma. Keep in mind, we are not giving Tamra Bhasma to the patient, we are giving copper powder after Shodhana process, because metallic copper is having a Vamana property. It is having a sort of a Vamana property. Just keeping it over the tongue, you will have a sort of emesis. This is a very nature of copper. So take this as a benefit. Add very small concentration. We are adding around 2 to 4 milligrams of copper powder, Shodhita Tamra Churna, into the Madanaphala, other mixtures whichever you are giving to the Vamana, because remember one thing, the Vamana Dravya is not going to assimilate or get digested into the human body. Instead, these drugs are said to be thrown out in the form of a Vamya substance. Whatever you have thrown out in the form of Vamana, all the contents whatever you have taken orally should be gone out. It should be thrown out. So this Tamra, whatever you have taken, it causes a Vamana Kriya, and it is being eliminated in the procedure of Vamana. So no need about the absorption, it doesn't get absorbed. You can give a macro particle of this one, not a micro particle, so that it causes only Vamana and it doesn't absorb. Instead it is being thrown out of the body during the process of Vamana can be achieved. Similarly, Vamana Rechana Karam, whenever you want to do the Shodhana of an individual, for Vamana and Rechana, even the textbook like Rasaratna Samucha have explained Tutta or Karpara, Tamra or Arkakshira, as per the various textbooks, have been explained as Vamana Rechana Karam. So by taking these drugs, it causes Vamana and Rechana, which can be used in the Vamana and Rechana Karma of the Panchakarma practice. Similarly, Jayapala is being used as Vantikrut, as per Rasatarangini, which causes vomiting. Similarly, Virechana Karaka, you can have Kankushta, Kampilaka or Jayapala or Snuhikshira, which is also very much beneficial for the therapeutic action, by which it can have a exclusive property of all the doshas being removed in the form of Vamana and Virechana. Similarly, the set of drugs as a Kushtagna, say for example, these drugs can be used for Shodhana and also Shamana purpose, like Pravala Garbha, Loha Garbha, Talakeshwara, Sarveshwara Parpati, they can be used as a Shamana and Shodhana purpose as well. The other drugs which can be given in case of Virechana, as per the textbook, is one thing is about the Jayapala, which is used in Virechana. The other substance is Kankushta, Garcinia morella. The other substance what we are taking for the substitute or the way how we are taking with that of the Kankushta, for the Rasadravyas we are taking as magnesite. We are not taking as a herbal component for Kankushta. So magnesite, which is found in the Almoda in Uttarakhand and Salem in Tamil Nadu attachment areas, are being used for this particular Kriya in the name of Kankushta in the clinical practice. Added to that, the Kampilaka, even for this we are taking the red sandstone which is available in the Saurashtra Desha, because Kampilaka, what we take it as Malatus philipinensis, is available all over the India, but the textbook speaks about Saurashtra Desha Utpannaha. So the substance which is available only in the Saurashtra Desha is red sandstone, and which is having a Virechana property. So I am taking this particular mineral drug for my studies, and definitely either things can be taken for their convenience and availability. Brudhara Shrinka is another substance which is very popularly used in many parts of India for the Virechana Karma. Similarly, next we are speaking about the Basti Karma. So the time between the roots and the fruits is quite different, is more harder part of the journey. So this is an important phenomenon. Once you treat the root, it means you have treated the whole tree, you have treated the whole shaka. and you are going to have a good fruits in a tree. That is because you have regulated, maintained or benefited the root. You have repaired the root. So this is the Basti Chikitsa. That is the reason why Acharya has claimed Basti Chikitsa as Ardha Chikitsa or Sampurna Chikitsa. So this is very much beneficial. When this Basti Chikitsa has been a very common protocol in the Panchakarma practice, this was thought as an important phenomenon for the Rasa practice as well. So many of the drugs, like whatever we want, like the Mrityunjaya Rasa, Trailoka Chintamani, Pravala Garbha Pottali, Parpatis, Sutashekara, we are mixing up with the Basti Dravyas, the oral route of the drug. Dosage form, the equal quantity is taken in the form of a Basti Dravya and it is being given to the individual in the form of a Basti, and it is being treated to an individual. So Rasushadhis in Basti Chikitsa is proved to be an efficient protocol wherein the drugs can be given with the different dosage protocols, or the mode of drug administration is different in the form of enemas in the patient. So you have a patient like ulcerative colitis wherein you can appreciate lots of bleeding conditions. You have lots of irregularity in the gut whenever you go for a colonoscope report of a patient. You can see an eventual improvement in the patient condition by successive treatments with that of the Picha Basti and adding Pravala Garbha Pottali, and also the drugs like that of Gairika along with the drugs of Picha Basti. The tremendous improvement in the anatomy of the gut can be achieved. Possibly it's a method where we need around 12 to 15 months to change the gut or the anatomy of an individual, but definitely the person will have lots of benefits whenever he has with that such dreaded disorders of autoimmune system like that of ulcerative colitis. So many of such treatment protocols can be planned up as you can observe in the patients in the clinical setup. Similarly, whenever you have such cases with the lower GIT, or where we take as a disorders or the sthana of the Vata, because the Pakvasha is considered as a sthana of the Vata, the disorders of the Vata, Vata Shamana substances are being mixed up into the Basti Dravya and it is being given. Might be it is Dashamula Niruha Basti, Rajayapana Basti, etc. So by that we can achieve a great level of Vata Shamana property in an individual. So similarly, I had a case wherein the patient was with ulcerative proctitis. Her age was only 9. So for her, in the form of a Matra Basti, I have given the Pravala Garbha Pottali, and within a period of a short duration of nearly 3 to 4 months, the patient had a significant improvement. We repeated the colonoscopy of the patient in some more time, wherein the study turned out to be normal. The gut is totally normal and absolutely no complaints or complications in an individual was being observed. So these are a few of the benefits or the advantages what you can see with that of a individual.